Education Minnesota. I've been working with your local for the past 7 years, and it's good to see you all. And I am here today to talk about the Public Employee Insurance Plan. And what Bruce was just talking...
I'm sorry, who do you work for?
Education Minnesota.
Okay, you work... Okay, thank you.
And for the purposes of the filming, if you could hold your questions until after I do the overview of the plans, and then we can just popcorn whatever comes up. So, why are we here? Local 2209 and Intermediate District 287 have been invited to participate in a multi-district health insurance pool. Now, as Bruce was explaining, this is the diagram right here of what it would look like. That multi-locals and multi-districts would pool together to have a larger pool of employees. In this case, it would be 42,000 potential members and 90,000 potential lives. So when I say potential lives, I'm including the employees and their families. And because of the significant size and potential opportunity to join this pool, that's why they're bringing it to you now. So what is the school pool? There is a statute that is basically the PEIP statute, and it allows individual bargaining units that are in school districts to withdraw from district insurance to go to the PEIP pool. It is the only way that you can withdraw from district insurance. This statute also says that you can join together with other employee groups, and that's what enables you to enter this large pool with these 42,000 other members. So how did we get here? There's about 340 Minnesota school districts, I think it might be a couple more than that, and 189 districts went for this PEIP pool bid. We were not expecting it to be this large. It started out with 30 ambitious local presidents saying, we have a problem, our health insurance costs are spiking, we should try to join together and investigate collaborating under this PEIP law. And so we started out with 236 districts that went for a bid, and then as Bruce was saying earlier, they got the bid on April 5th, and then executive boards had to decide, are we taking this to a membership vote, or are we passing on the bid based on the numbers? So 189 districts have decided that they are taking it to a membership vote. And the numbers that we have now from PEIP are not going to change. They have promised if you have decided that you're going to take it to a membership vote, these are what your premium numbers are going to be. Alright, so why is it important for you to join in a larger pool of employees? Basically there's two reasons. One is that large employee insurance pools create premium increased stability. If you look at, there's a handout here that says comparison of premium history from 2005 to 2006 through 2010-2011. And this is just meant to demonstrate the power of large pools. As you can see from your line, District 287, you have some low points like the 0.87 in 2005-2006, but immediately the next year you have a 26.5. That's what we call a spike. If you look at the larger employee pools, like the CGIP, the State Employee Group Insurance Program, they have no more than 10. They have a lot of zeros, a 6.7, a 3.5, and it averages out to be about a 3.5 increase over each of the 6 years. And in fact, they've had a 0% increase over the past 3 years. The other issue is that when you are bargaining with insurance companies, they know that smaller groups have less bargaining power, and so they're more likely to take advantage of you. And so when you get together with a big pool like this, you have more bargaining power with the insurance companies because they want your business. You're going to be a substantial amount of business. And that's actually impacted what's happened with you right now in 287. Just going for the bid has made an impact on what your premium rates from Health Partners have been quoted for next year. What Health Partners did was they waited until the school pool rates came in, and then they underbid it. So the school rates came in, and they gave you a 5% decrease for next year, hoping that you are going to stay with Health Partners because of that decrease. So if you look at this sheet right here, and depending on your plan, it will say something different on the top. It says comparisons for employees who have the, and I'm holding the deductible plan, but if you have select choice, it'll say select choice. If you have open access, it'll say open access. And basically what this is it's a comparison of what the total premium is per month, employer and employee. That's in the first box here for the current plan that you're on. What the quoted rate from Health Partners is for next year. What the cost difference is between what you're paying now and what you will pay. And obviously if there's a decrease, those numbers are in parentheses. And then the employee cost difference to you. And this is per month, so it's not going to exactly match what your biweekly deductibles will be, or not deductibles, deductions will be. These rows below it indicate what would happen if you were to switch to PEIP, depending on what plan you join. So PEIP has 3 different plans, so you would have a choice between Advantage, Value, and HSA Single. So that's just kind of how you read this. And I'll talk more about this as we go through it. All right. What else can you... Oh, wait, we got it. Okay. This is good. So we talked about premium cost stability. Long-term savings, what that is referring to is when you're not having these spikes and decreases over time, there's a long-term savings because you're only getting incremental increases in comparison. Plan design stability. Plan design comes up as a negotiations item every time you go to negotiate a contract. I know you just had a really large change in your plan design this last go-around. So the advantage with PEIP is you know what the plans are, they're not likely to change. They can change if the PEIP board decides to change it, but it's not likely to. So there's some stability in knowing what you're going to get. You do have more choices. As I said, there's 3 different plans, which means there's 3 different premium levels, and there's a broader network. And we're going to get to that in a second. And as I was saying before, it's one less thing to bargain about because plan design is off the table. Okay, so why now? You have probably heard about Education Minnesota's constant calls for lobbying regarding mandatory statewide health insurance. And we've been trying to do that for about 10 years. It's been vetoed every time. And it seems unlikely that that will change in this current political environment. And so this is an attempt by some of your brothers and sisters in other unions to take matters into our own hands and try to solve the crisis on our own. It is a huge opportunity for your local because there's never been a pool this big for school district employees in the state of Minnesota. And specifically, why right now? The people that created the pool have decided that in order to make it a fair process, because there's so many locals involved with this, they have decided that everyone is going to get the rates at the same time and make the decision based on the rates. The fear is that if they allow people to come in later on in the process, that it will have an effect on their claims data, because higher claims people or higher claims districts may want to join the pool because the rates are lower, and so it would attract those higher claims districts. And so they're trying to avoid that. So the rules of the pool are if you don't join now, you're going to have to wait 4 years from the date you vote to go to PEIP. So what will happen is, you vote to go to PEIP, so let's say we do this next spring, you vote that you want to go to PEIP. PEIP will allow you to take their health insurance, but you're going to be pooled separately on your own claims data for 4 years, and then you'll be incorporated in the larger pool. Okay. So we're going to go through the plan design of PEIP to give you a better idea of what you're voting on. So PEIP offers 3 choices of 3 different benefit levels. And as I was saying before, that's the Advantage level, the Value level, and the HSA level, which is basically a high deductible level. The Advantage is going to be your highest premiums but your lowest copays and deductibles. the value is a middle plan, and the HSA is a high deductible plan. And that's obviously going to have the highest deductibles and the lowest premiums. And each benefit level includes the choice of 3 different health insurance networks. So right now, you are just on Health Partners Network. If you join PEIP, you would have the choice between Blue Cross Blue Shield, Preferred One, and Health Partners. And then each plan provides 4 different cost levels. It's cost level 1 through 4, and the way they determine cost level is based on your home provider, your family provider. So that could be a clinic, it could be an individual doctor, but whoever your family doctor is, that's going to determine your cost level. And what PEIP does annually is they send out basically questionnaires to find out cost information from every provider that's within the 3 networks in the state of Minnesota. They find out how costly their services are, and the lowest cost clinics and providers are in a cost level 1, the highest cost clinics are in a cost level 4. So your Mayos, your Universities of Minnesota, those are going to be in cost level 4, but by far and large, the majority of your local clinics are in a cost level 1 and a cost level 2. And there's an easy way to look up what your cost level is. I believe that Bruce sent out a link where you can just type in your family doctor and it'll pop up what insurance provider you would have to enroll in and what their cost level would be. I go to Fairview. Fairview is a cost level 2. I believe North Memorial was a cost level 2. Health Partners is a cost level 1. So I think those are, mainly the big players in the metro area. Okay, I just covered this so you can skip ahead. I'll keep going. I told you I was bad at the script.
It's okay. It's good for folks to...
Okay, so here's where the cost savings come in. Providers, once they are assigned a cost level, they have an opportunity to rebid with PEIP. So some providers might not like being a cost level 3 because that means that they get less clients. Because you have to remember that the state employee, the CGIP, the State Employee Group Insurance Plan, is on the same cost level and the same plan as PEIP is. It's pretty much a clone. And so that's a lot of business for these providers. And so if they are given a level 3 cost level assessment, they have an opportunity to go back to PEIP and rebid so that they could be classified as a cost level 2 and hoping to attract more business. It's also a cost savings because the structure encourages employees to enroll in the lower cost levels, so the cost level 1 and the cost level 2, because they have lower copays and deductibles. So preventative services, this is the same as what you have now. It's 100% covered. No copay, no deductible. And this is just to give you an idea of what the different cost levels would look like in terms of what your out-of-pocket costs would be. So this is looking specifically at the Advantage plan, which is the high plan. It's the same plan that the state employees are on. At a cost level 1, your annual deductible is going to be 50 single, 100 family, up to a cost level 4, where it's 600 single, 1,200 family. So you'd be paying more out of pocket if you're going to those more expensive clinics. All right, so I'm going to direct you to this handout right here, again, where it has all the different premiums. And you can do the premium cost comparisons on your own and see if you would want to stay with a plan that's similar to the plan you have now, or if you want to switch. It might depend on the coverage. So if you go to the first page, what I've done is I've taken your current plan coverages and I've listed them in this first column. And it should say HP, Select Choice, or Open Access, or Deductible. And then in the next 3 columns, what I've done is I've outlined what Advantage Cost Level 1 looks like in terms of copays and deductibles, Value Cost Level 1, and the High Deductible Cost Level 1.